Good afternoon, everybody. My name is David Kaeo. I'm a student with Professor John Marlowe, and today we're going to be talking about kidneys and why you need to take care of them. So a little bit of an overview of the presentation today. What are your kidneys? What does renal failure mean for you, or kidney failure mean for you? What causes it, and how you can prevent it? By the end of this presentation, hopefully I can answer this question of why you need to take care of your kidneys. Personally, I chose this topic because I'm a dialysis technician. I see renal failure all day long, and it really hits close to home when you see the patients going through what they're going through, and you know it could actually be preventable. So, what are your kidneys? What do they do? Does anybody know?
Cleans your blood.
It does clean your blood. Very good. Anybody else? Okay, so your kidneys. They're fist-sized organs located just below your ribcage on both sides of your spine. They do many things, including producing hormones, regulating things such as blood pressure, pH, and electrolytes. They remove harmful waste and toxins as well as excess fluid. The kidneys are very interesting in the sense that they filter over 180 liters of blood a day. Now, to kind of get that, like wrap your head around it, I guess you could say, that's a little over 1,700 of these bottles. Okay? Every single day, that's how much your kidney filters. Each kidney contains over 1 million nephrons. Now, nephrons are thinner than the human hair. And this is what's called a dialyzer. This is something that I use every day at work as well. This replaces your kidney during your dialysis treatments. Okay? In here, there's thousands and thousands of strands that the blood filters through. The funny thing is, I have to replace this every single treatment. Yet your kidneys don't need to be replaced unless they fail. Usually kidneys will last your lifetime. So what does kidney failure mean for you? It's a domino effect of health conditions. Once your kidneys fail, other things happen. You become anemic. You can have things like congestive heart failure, fluid overload. It really tends to put you in a very, very bad situation. You have lack of energy, you don't feel good, food doesn't taste good, you don't sleep. You just really don't feel like doing anything but laying there a lot of the times. It also means death. If you leave it untreated, there's no ifs, ands, or buts. You're gonna die. Nobody wants to die. If you don't want to die, obviously, you have to go on either dialysis or get a transplant. Now, dialysis is okay. There's downfalls to it as well. You deal with needles. I mean, big needles. 15 gauge to be exact. I'll put 2 NDs in your arm 3 times a month. You could also get a transplant. Problem with that is you have a chance for rejection. You're immunocompromised for the rest of your life, and you're also drug dependent for the rest of your life. Either way you go, drugs are going to be involved, and drugs can be very, very, very expensive. They have a lot of side effects as well, and nobody wants to be drug dependent, right? So your primary causes for kidney failure. 44% is diabetes. Now, does anybody here have diabetes? No?
No.
Do you know anybody that does?
Yeah.
Okay. How about hypertension or high blood pressure? Anybody here?
Oh, not it.
But you definitely know somebody that does, right?
No.
Yeah.
Well, hopefully let's keep it that way. Okay. 23% of renal failure is congenital or has to do with other conditions like polycystic nephrosis and other weird names that I really honestly can't pronounce. Another 5% is for an unknown reason. Doctors can't quite figure it out. They just know that the numbers are there and their kidneys aren't working. Now, this is a graph from 1980 to 2009. You can see this nice little raise, right? Everybody can. This represents a 600% increase in ESRD patients. Okay? So back in 1980, there was 209 people per every million that was dealing with end-stage renal disease. By 2009, there was 1,700 cases per million. It's a huge increase. And the really, I guess, sad thing about it is a lot of this is preventable. So how can you prevent it? Okay? Educate yourself. Learn about it. I mean, this is your life. You only have one body, one life. You need to learn how to take care of it and help yourself. Diet, exercise, it's a very good way to help yourself. Watch what you eat. You know, some kidney failure is due to a poor diet. You know, if you're consistently drinking soda after soda after soda after soda, you can eventually develop diabetes, which will eventually lead to renal failure. Okay? Monitor your health. Talk to your doctor about your blood work. You know, if something's not right, go see them. Because any type of preventative maintenance that you can do for yourself is going to help you. Like I said, take corrective action. If a doctor points something out to you, definitely don't just brush it aside, because that's what a lot of those people did. They just brushed it aside, and next thing you know, hey, you got to go on dialysis. It's funny because that's exactly what happened to one of my patients. I'll refer to her as RY, privacy laws and things like that. But I talked to her, and she said she didn't know anything about renal failure until it hit her. And it's sad because a lot of my patients say the exact same thing.
Also, of my heart, do I have diabetes? Am I borderline? Just ask your doctor. Because a lot of times they'll tell you, oh, this is good, this is good, your A1C is good. What is A1C? Talk to me, you know, and talk to your physician and try to get a better understanding about your body. So one of the jokes that I used to do here is when
Now,
I know
what you guys just heard is actually the patient that I talked to. That's my recorded interview with her. And it's really funny because a lot of what I heard out of her kind of resonates with what I heard with most of my patients. Here's a couple quotes from our interview. Be aware of your body and health. Talk to your doctor. Ask, how's my heart? How's my health? One that really kind of made us chuckle a little bit is, besides sex, this is the most invasive procedure to my body. And I don't have sex 3 times a week, but I have dialysis treatments 3 times a week. It's invasive because they have to stick needles in me. And my blood gets drawn out, cleaned, and they're doing things that my kidneys can't do anymore. She also shared with me that her husband worked for major soda companies for over 30 years, which contributed to her diabetes, which contributed to her renal failure. And you can kind of see how it's a snowball effect. You know, something that you can prevent now is going to help you down the road. The last one that's listed here, it said, I want to let them know that this is avoidable. They don't have to be here. That was in response to a question that I asked her saying, if you can give advice to the younger generation, what would it be? And that's exactly what she said. So let's review. What are your kidneys? Your kidneys are life-supporting organs that are essential for survival. Without them, you're not going to be around very long. What renal failure means for you? If your kidneys fail, you will have to go on dialysis. You may have to get a transplant, or you're going to die. Sad but true. I mean, I don't want to sugarcoat it because it's the truth. What causes renal failure? Diabetes and hypertension. That means, if you go off of statistics, 72% of the cause for renal failure is preventable or controllable. It's a big number. It's a very big number. Lastly, how can you prevent renal failure? Educate yourself. Keep track of your health. Do diet and exercise. So, why do you need to take care of your kidneys? Can anybody answer that now?
Too late.
That concludes my presentation. Thank you, everyone.